Welcome to British Biomedicine Institute. Today we will explore principles of neuroimaging, brain imaging, and radiodiagnosis. Neuroimaging is a discipline that studies the structure and function of the nervous system by means of imaging technology, and where the images of the brain can be obtained in a non-invasive way. It explores a series of mechanisms, such as cognition, information processing, and brain changes in the pathological state. Neuroimaging or brain imaging is the use of various techniques to either directly or indirectly image the structure, function, or pharmacology of the nervous system. It is a relatively new discipline within medicine, neuroscience, and psychology. Physicians who specialize in the performance and interpretation of neuroimaging in the clinical setting are neuroradiologists. Neuroimaging falls into two broad categories. Structural imaging, which deals with the structure of the nervous system and the diagnosis of gross, large-scale, intracranial disease, such as a tumor, an injury. Functional imaging, which is used to diagnose metabolic diseases and lesions on a finer scale, such as Alzheimer's disease, and also for neurological and cognitive psychology research, and building brain-computer interfaces. Functional imaging enables, for example, the processing of information by centers in the brain to be visualized directly. Such processing causes the involved area of the brain to increase metabolism and light up on the scan. One of the more controversial uses of neuroimaging has been researching thought identification or mind reading. Neuroimaging follows a neurological examination in which a physician has the found cause to more deeply investigate a patient who has or may have a neurological disorder. One of the more common neurological problems which a person may experience is simple syncope. In cases of simple syncope in which the patient's history does not suggest other neurological symptoms, the diagnosis includes a neurological examination, but routine neurological imaging is not indicated because the likelihood of finding a cause in the central nervous system is extremely low and the patient is unlikely to benefit from the procedure. Neuroimaging is not indicated for patients with stable headaches which are diagnosed as migraine. Studies indicate that presence of migraine does not increase a patient's risk for intracranial disease. Another indication for neuroimaging is CT scan, MRI and PET-guided stereotactic surgery or radiosurgery for treatment of intracranial tumors, arteriovenous malformations, and other surgically treatable conditions. A diagnosis of migraine, which notes the absence of other problems, such as pupil edema, would not indicate a need for neuroimaging. In the course of conducting a careful diagnosis, the physician should consider whether the headache has a cause other than the migraine, and might require neuroimaging. Diffuse optical imaging, DOI, or diffuse optical tomography, DOT, is a medical imaging modality which uses near-infrared light to generate images of the body. The technique measures the optical absorption of hemoglobin, and relies on the absorption spectrum of hemoglobin varying with its oxygenation status. High-density diffuse optical tomography, HD. Has been compared directly to fMRI using response to visual stimulation in subjects studied with both techniques, with reassuringly similar results. HD. Has also been compared to fMRI in terms of language, tasks and resting state functional connectivity. Magnetic resonance spectroscopy, MRI, is a non-invasive magnetic resonance technique that does not use radiation. MRI scans are obtained in MRI scanners, which look like a large cylinder with a tube running down the center. Functional magnetic resonance imaging, fMRI, measures blood oxygenation changes that occur in the brain. These images could be used to determine which parts of the brain are handling critical functions, or to evaluate the effects of a stroke or disease. Additionally, this technique is crucial for pre-surgical planning in patients with epilepsy or brain tumor. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.